Republicans did what they say they're going to do.
If there was a robust market to ensure the people who were added to in the insurance rolls under the Medicaid expansion, these are basically the working poor, people at 125% of the poverty rate, if there was such a robust market to offer them insurance, then why wasn't it there before Obamacare?
Well, if we're speaking about those people on Medicaid, the CBO assumed some of them would leave Medicaid, but Medicaid is free, so they're required to be on it under Obamacare, and the CBO assumed some of them would leave, despite the fact that it doesn't cost them anything.
Lose their they would no. I'm sorry, they would not leave. This is not people voluntarily saying, you know what, I choose to go uninsured. It's people losing their health insurance, essentially not having health insurance anymore. I want to get into
under the Senate bill. Nobody
under the Senate bill. They would lose. 22 million people would lose their health insurance. The bulk of that would be because of cuts to Medicaid. I want to go specifically into it because I want to make sure that people really understand it. Because there are two different buckets of insured. There are about 10 million people who buy on the non-group market. That's who you and the Republicans legislating for, just them, the 10 million people who buy insurance under Obamacare. So if we talk about those people, the new bill that the Republicans are proposing would essentially force, this is a great piece that the NBC News did a great analysis of this, and it essentially said the bill would require people to pay higher premiums, this is the non-group people, to buy a private plan that's similar to what's already under Obamacare. So they'd have to pay higher premiums to get what they get under Obamacare now. And then it would reduce spending on the subsidies and distribute them in a way that encourages people to instead purchase a high deductible plan with lower premiums. So people who would get lower premiums would just be stuck with a high deductible plan. You think that's better?
No, not in that specific case.
That is for the non-group market. That's what would happen.
Well, the CBO said late this week that this bill would actually drive the cost of premiums down by about 30%.
For people who were getting they would drive the cost of premiums down for people who were then pushed into high deductible plans. You pay a lower premium, but when it comes time to use your insurance, you're paying a much higher deductible. Right. That's exactly what the CBO said.
What those people are going to have under the Senate bill is more choice. We know that when they have more choices, they're going to exercise that choice, and that's going to affect the behavior.
That's a great bumper sticker, because remember, we're still only talking about the non-group market. Hold on, but you're basically saying that if people can buy more junk insurance, insurance that really doesn't cover much, insurance that has low premiums but doesn't cover you when you're sick,
insurance that covers the things they want,
that are basic things, and most people like the services that they're getting under Obamacare, the free mammograms, et cetera.
I think most people want to pick the services they get, not have the federal government
pick them for them. Would they also want to pick to be uninsured? Because you guys keep on saying that people would voluntarily disenroll from insurance, and there's no. Would you voluntarily disenroll from insurance?
I didn't say that. The CBO said that.
No, the CBO didn't say that. It said they would lose their insurance. It said very specifically they would lose their insurance.
They said a few million would volunteer
lose their insurance. And the only people who would voluntarily disenroll, and the only people who actually, again, get lower premiums, people who don't want to pay the penalty under Obamacare and therefore disenroll because they didn't want to buy insurance. That's a tiny fraction of the American people. It's of that 10 million, you're talking about maybe a couple of million people. And then it also says at the same time that when you take away the subsidies from people, low-income seniors will be hurt the most. This is what the CBO
under the Senate bill.
The biggest spikes in uninsurance, and I'm just saying what the CBO said, the biggest spikes in uninsurance come for older, low-income customers who would also have the hardest time finding affordable insurance. What do you think?
Well, look, if we're talking about the CBO, let's just think about how they did predicting how much Obamacare would cost.
Answer my question. We don't have time to talk about the CBO's methods. Do you think that it is a valuable trade-off to have lower-income people, the oldest and lowest-income people, have the hardest time finding insurance and be the most likely, the biggest spikes in losing their insurance?
No,
do you think
but
that's
I don't think that will happen under the Senate bill.
That's what the CBO says will happen.
And I don't believe them.
Okay,
and I
let's go to Jonathan
anybody
Cohn.
should, given their track record.
Why shouldn't they? Because they were spot on in the number of people who would get insurance. They had a different mix because they assumed that states.
Yes,
no,
they were incredibly wrong about it. They were wrong about how much it would cost and who would be insured.
They were not. Health costs have gone down, and the number of people overall that got insurance were correct.
Health costs have not gone down.
The mix of who
increased.
got it in the non-group market versus the 72 million people on Medicaid, the mix is what they got wrong. I want to get Jonathan Cohn in here because the thing that we know about this idea that is floating through the Senate, and this is aside from them saying we'll just repeal the whole thing, is that there's a one-for-one trade-off taking place here. Approximately $700 million in tax cuts that go overwhelmingly to not just the top 1%, but the top 0.1%. So $700 billion in tax cuts for them, for $700 billion in cuts to Medicaid. And that is the equivalent, essentially, of having the top 400 richest households in America Okay, the top 400 richest people in America, their tax cut is the equivalent to Medicaid for Arkansas, Alaska, West Virginia, and Nevada combined. Is that a fair trade-off in any way in your mind, Mr. Cohn?
So, I mean, look, whether it's a fair trade-off is, you know, people, that's a value judgment, right? I mean, some people would say it's fair, some people would say it's not. But I think that's exactly the right way to think about this. And, you know, we talk about health care. There's so many moving pieces. You know, you were just talking with your guest about the mandate and the effects of the subsidies and where it all should. And you know, and there's some dispute over where, you know, how this piece affects that piece and how many people are voluntarily dropping coverage or whatever. But the key thing to remember, to pan out just like you did, to say, look, this is taking $1 trillion away from programs that help people pay their medical bills. It's coming out of Medicaid. It's coming out of subsidies to help people buy private insurance. If you take that much money out of federal health care programs, $1 trillion over 10 years, one way or another, you are telling millions of people they are not going to be able to pay their medical bills. It's just a reality. That is what we are looking at with this bill, and that is why this bill is so hard to pass, because every time you look at it, they tinker with the pieces. They move a little money here, they move a little money there, but at the end of the day, there are millions of people who won't have health insurance. There are millions of people who will have health insurance but will have even higher deductibles than today. You know, Obamacare is not perfect. Everybody admits that. It needs improvement in a lot of areas, but relative to what we have today, you pass the Senate bill, pass the House bill, you will have substantially more Americans in the millions who will be struggling relative to today.
Mr. Binion.
It's faulty logic to say that every dollar the federal government spends on health insurance is the only dollar that could help people. We know from 200 years of American history that the free market and free enterprise delivers the best products. Why would we take that out of the healthcare market and just
you're giving us theoreticals when we're telling you if you take the absolute dollars that you spend to cover people with Medicaid, to give people insurance cards, and you reduce that by $1 trillion, that if you, in absolute dollars, that means fewer people can be helped by the program. If you repeal the Medicaid expansion, everyone who was added to Medicaid because of the expansion comes off Medicaid because the expansion isn't there. The theoreticals about the free market don't give people health care. I want to come to, it doesn't give people health care for you to talk about the free market. Talking about the free market makes you feel good. It doesn't give everyone a medical card.
No, the government won't solve all of our problems.
Then why
the American people know that.
And by the way, the Senate bill. Why weren't those people insured under the free market before Obamacare?
More people will be insured if health insurance is cheaper. Health insurance will be cheaper.
Insured under the free market system we had before Obamacare?
Many of them could have been and chose not to. They weren't insured until the government forced them to be.
Then why did they sign up? You're saying that people wouldn't have wanted the Medicaid expansion. They wouldn't have taken Medicaid and had an insurance card to go to the doctor.
The Senate bill doesn't change the population of people eligible for Medicaid.